everyone. My name is Dr. Kushka. I'm a family nurse practitioner, and today I'm with Dr. Wendy Wang, and we're both from Anning Health.
Yes, and today we're going to talk about colon cancer screening. Do you know how common is colon cancer? According to World Health Organization in 2020, they found almost 2 million new cases diagnosed with colorectal cancer. Symptoms are you might find blood in your stool and you might have unexplained weight loss.
So the weight loss usually is patient lose a lot of weight in such a short period of time, and also the bleeding, usually they don't feel any pain.
And that can distinguish, between maybe hemorrhoids or fissures as compared to this is some unknown cause of the blood that you found in your stool.
So sometimes, even though they normally don't feel pain, but I do have a couple of patients that they do feel pain in the pelvic area. So it really depends on from patient to patient.
So colonoscopy is the gold standard for colon cancer screening.
That's right. So a lot of patients that actually still be encouraged to take the colonoscopy, not just a screening, but also diagnostic and a procedure at the same time. So with the GI doctor that they see something's wrong with it, and they will take the intervention.
And they scope into your colon to different parts to see if they found any polyps or any lesions that they might want to send for biopsy.
Right. It also depends on the patient's symptoms. Some patients that they might have a bleeding, and they need to know which portion of the colon that has a bleeding.
So how often should we do colon cancer screening? Recommendation is to start at 45 years old and end at 75 years old.
This is actually a new update, and since this year. So there used to be 50 years old. So a lot of a patient actually, when they found out they have a colon cancer, it's kind of too late. And there's many risk factors contribute to it, such as the family history and also the bad lifestyle.
And a lot of people think that colonoscopy is very painful. Actually, when you go to the specialist, they will put you under anesthesia and make you very comfortable.
So this is only one-day procedure. You will not be admitted to the hospital or anything like that. It's an outpatient procedure, and make sure somebody can take you home on the same day. Of course, a lot of patients that they don't like colonoscopy, and of course we have other options, right? Oh, so we actually have this. It's called a Colonguard. So what is a Colonguard is they check the stool sample every 3 years. They're not just looking at if there's any bleeding that in the stool, but also the DNA of the cancer cells. So how you can get started, your primary care provider will be able to initiate this, and they can mail to your home, and you just follow the instruction. So with the different languages, we know that there's a Chinese, there's a Spanish, and so tell your provider about what kind of languages you prefer you're reading it, and then they will send it to you as well.
So the other option I would like to talk about is this what we call fecal occult blood testing. What it does is your healthcare provider will give you an envelope. You're going to take it home. Inside has many different tools that you will need. It's quite simple. It will have a bag to help you collect the specimen, and the steps will be inside. There are other tests for colon cancer screening also, but these are the few most common type.
So when you have questions about how to use the test or which one that you want to choose, you can always give us a call to have a question or consultation. And we are from Anning Health, and my name is Dr. Kushka.
And I am Dr. Winnie Wang.
And we'll see you soon.
Bye-bye.
Bye-bye.